Good afternoon. Today is Saturday, April the 4th, and I'm Alan Bandriel, the CEO at Smith County Memorial Hospital. Beside me is Dr. Hannah Hack, our Chief of Staff. And we just wanted to share a message to the community this afternoon about the COVID-19 pandemic and the community response to it. As you all are no doubt aware, Smith County, as of the present time, does not have any confirmed positive cases of COVID-19. I think this is the calm before the storm. If you look at the map that KDHE posts on a daily basis and updates, you will see that counties around us have reported positive cases. Osborne, Jewell, Mitchell, all three have reported positive cases of COVID-19. And counties near us in Nebraska also have positive results and are actively treating patients for COVID-19. So I think before too long, we will start to see positive cases in Smith County. Over the last couple of weeks, there's been a lot of activity from the governor's office and from the local health department talking about how best to flatten the curve, as epidemiologists say, to prevent the pandemic from affecting Smith County. Flattening the curve means taking measures that will either spread out the incidence, lengthen the time before we see a lot of cases, or decrease the peak number of cases that we have in Smith County. And so when we say flattening the curve, we're talking about complying with those executive orders that the governor has published and the local health department has published. Currently, the local health department order says anyone who has traveled to the Kansas City area or the Wichita area within the last few days needs to self-quarantine for 14 days as a preventive measure against developing symptoms of COVID-19 and transmitting it to other people. All of these measures are preventive measures designed to help keep the incidence of COVID-19 when it occurs from spreading as widely through the county. And we're very concerned about that from the standpoint that if we start to see cases, it could spread very rapidly. We need to take this very seriously. When the governor, when the CDC, when the local health department, all of these authorities, when they say stay at home, they mean stay at home. There's a lot of activities that have been disrupted by the pandemic that's currently underway. Businesses have been disrupted. Churches are doing their church services by electronic media now. Schools have been canceled through the remainder of the year, and all the students are doing their classwork through electronic media. All of those things are designed to increase social distancing and help flatten that curve, help decrease the spread of this pandemic.
The stay-at-home measures are really out there to protect you and to protect us. The more you can adhere to that, the better we're going to do as a community. You think about going to the grocery store, this is something that's essential. Everyone has to do this. And so then if a healthcare worker, let's say this is healthcare worker works in the nursing home. The nursing homes are locked down right now. That's for the safety of the residents. The people who are most at risk of this virus are people who have underlying chronic medical conditions such as lung disease, heart disease, diabetes, or they're elderly. They will not do well if they get this disease. Now let's say this healthcare worker goes to the grocery store because they need milk or eggs, because they need to feed their family. Well, if someone else has not been staying at home or is not following the self-quarantine and they were exposed and don't realize it, and they spread this to that person, and then that healthcare worker takes it to the nursing home, that's a lot of people who could be affected very quickly. We don't want to have to be making decisions about someone who's elderly, who we can't effectively take care of. We can try supportive measures, but there's nothing that can treat this disease effectively, and those people will not do well, and it will spread very rapidly. We don't want to have to be in a position where we have to take care of your family member or your grandmother or our grandmother, because we're a small community, and not be able to do anything to help.
We're very concerned about it from the preventive standpoint as far as our staff is concerned as well. As we've posted on Facebook previously, we've started taking increased measures to safeguard our patients and our staff in the hospital. We're limiting visitation much more strictly than we had been previously. We're screening everyone who comes into the building for the danger signs as far as COVID is concerned. All of our staff are getting screened every day when they come into the building and are wearing a marker to indicate that they have been screened for presence of the disease. Screening is different than testing. When we screen, all we're doing is testing or is asking questions about symptoms that a person may have. And one of the concerns that many people have about testing is that there is a very limited supply of testing materials. So we're limiting testing only to people who are presenting with symptoms. We're not doing widespread testing of the disease. We're doing everything that we can right now to protect our staff and to prepare for the presence of the disease and prepare for further protective measures of our staff. But you can help us by adhering to that social distancing and help us flatten the curve so that we delay the presence of the disease and we minimize the number of cases, which helps us minimize the risk to our staff. So our message to the community is, please pay attention to those stay-at-home orders. Please practice social distancing. Please wash your hands frequently. Please stay home. Thank you.